You're welcome. Now we are ready.
Okay. Welcome to the October 10th, 2024 meeting of the Health and Environment Committee. My name is Barack Freeman. I'm the member of the committee. I'm chairing tonight's meeting in Chair Elvie Barrosa's absence. Tonight, we are joined by Assistant District Manager Brendan Berth. This meeting is called to order at
6:36.
6:36. As a reminder, New York State law requires all committee members who are not able to attend the meeting in person to have their cameras on and their first and last names displayed from the time the meeting is called to order until the time the meeting is adjourned. Members of the public who are attending virtually, you can raise any questions or comments that you have through the Q&A feature of Zoom. Members of the public who are here in person, you can raise any questions that you have by raising your hand. If there's time following the committee's discussion, we will field questions from the public. We need a volunteer to take the minutes tonight.
And for anyone newer, we do send the meeting minutes template and other stuff afterwards, so.
Would either of you be able to take the minutes?
I'll try.
Okay.
Yeah, we'll send you the YouTube stream and the transcript and whatnot afterwards. We won't leave you without resources.
Sounds good.
And thank you.
Thank you.
And we will now take attendance by roll call. Brendan will conduct the roll call.
Committee members, I will call your names. When your name is called, please say present. I will announce if there is quorum. Marty Barrett.
Present.
Elvie Barrosa won't be with us tonight. Barack Freeman.
Present.
Sandra Leftoff is not here. I also, she'll be coming later. David Levy, I think will be coming, but I don't see him yet.
He's no longer on the committee.
Oh, okay. Miriam Rowe won't be with us tonight, and Mubin Siddiqui.
Present.
Okay, we don't have a quorum.
I'm here too.
Yes, but under, yep, you're counted as present, but under extraordinary circumstances. So present, but not counting towards quorum.
Okay. The agenda for tonight's meeting was distributed ahead of time by the board office and is reflected on the screen before you. If there is no objection, we will adopt the agenda. Members of the committee, if you object to adopting the agenda, please raise your hand. Seeing no objections, the meeting for the agenda, tonight's agenda meeting is adopted. The minutes from September 12th meeting were distributed ahead of time by the board office. If there is no objection, we will adopt the minutes as drafted. Members of the committee, if you object to adopting the minutes, please raise your hand. Seeing no objections, the minutes from the September 12th meeting are adopted. They will soon be available on the CB6 website. In order to conduct an efficient meeting, let's observe a few ground rules. First, no one may speak until granted the floor. Second, committee members who are here in person, if you have a question about committee business or wish to make a motion, please raise your hand and I will identify you so you can speak. Third, committee members unable to attend in person. If you have a question about committee business, you may raise your hand through Zoom and I will identify you so you can speak. For all committee members, it is extremely important that only one person speak at a time so that members of the public watching at home can understand what is being said by each committee member. The chat function for committee members present via Zoom should not be used for committee business or questions about agenda topics. All such remarks should be made on the record by raising your hand through Zoom. Chat should only be used to alert us to any technical difficulties you are having or to state in writing information like an email address that was already stated aloud on the record during the meeting. Okay. So we are up to the first item in the agenda, which is a report from NYU Langone Health on emergency department trends and what community members can do if they see someone in distress.
Also, just one thing before the presentation, just for the record, we now have a quorum, so not that the committee is likely to vote on anything, but if it did want to, there is a quorum.
Thank you.
Anyway,
Okay. We have a speaker from NYU.
Yes, hello. Hey, good evening. My name is Dr. Akinetwe. I'll be speaking for NYU. Am I supposed to share my screen or is your team?
you should be able to share your screen, but if you have any technical
Gotcha.
difficulties.
Okay, let's see.
let us know.
Thank you. I'm not the most technology inept person, so I apologize about this. I thought my slides would be shared by your team, so give me 1 second.
Yeah.
Yeah,
And if
Brendan,
you have any issues, we do have the slides as well, and we can also share.
Rebecca, do you have the slides up? Can you send it? Can you
yeah,
share?
I can share, or Brendan, is that easy for you? You have
Yeah,
them?
I'll share. Just
Thank
make
you.
sure to let me know when to go on to the next.
Absolutely. Absolutely. Thank you so much. So thank you so much, for allowing me to speak to you today. Once again, my name is Olu Akinetwe. I am the Associate Chief of Service for the Emergency Department at NYU Langone Hospital. And I'm going to quickly just, the basis of my talk is just to give an intro and an overview of our emergency department as well. So many of this might be repetitive for many of you before in the past, but I wanted to share some of the things we do in the ED, what we're seeing, and also some the resources that we do have, and then on some of the community outreach work that we'll be doing as well. Next slide. So this is just a brief objectives and overview of what I'm going to be talking about for the next few minutes. So once again, just an overview of the department. Discuss the resources available for acute patients and also some of the outreach work that we do as well. And we also plan on doing with the help of this committee. Next slide. So this graphic is just a snapshot of our department as a whole. On the left, it really highlights the clinical work that we do and resources that we have as well. So we have about 318 total ED providers. So that includes MDs, DOs, PAs, who are physician assistants, and nurse practitioners as well. We do serve approximately 6 sites, with our main campus on 33rd and 1st Avenue. We see about 570,000 patients annually as well, including telemedicine visits, which I'll discuss more. And because we're a department within a large academic center as well, we do emphasize education and research and quality. So we do, as a department, also have 9 fellowship programs for our learners. We have about 150 trainees. So these are graduate students or MDs who are training to be board certified emergency medicine doctors. And also, we also have an advanced practice practitioner fellowship program as well to ensure that we're training the future of PAs and NPs in the ED. And one thing I want to highlight is our focus on the quality of care that we provide to our patients. We actually recently ranked #1 in care by Vizient Health. And I'd like to say that quality starts in the ED. Next slide. So this is a quick, just a background of our department as it sits. So this is an article that I actually, was shared with me by one of my colleagues that was written in the New York Times in 2014. So the emergency department we opened up actually in 2014 after it was closed due to for about a year and a half due to damages sustained during Hurricane Sandy. So the ED opened in 2014, and we actually expanded our ER in 2018 to actually give us what we're proud of about approximately 156 care spaces that we actually provide to our patients. So we are a large ED, able to see a large number of patients, and we'll continue to grow as well. Next slide. And when we talk about growth, this graph is actually astonishing, to say the least. We've actually exceeded our volume every single year since its opening. And we actually had record volume in 2013, fiscal year 2013, when we saw over 100,000 visits. And actually, the most recent fiscal year, we actually saw over 115 visits as well. Just to provide this group some context, when the ED actually opened up in 2014, the average daily volume that we saw was about 142 patients. And now we're seeing about 100. And, you can see in the month of September, a few months ago, but this month actually, we've actually seen 327 patients. So we've actually expanded our volume by over 100%. And, this increase in volume is due to multiple factors. It's included, New York City's, we have a growing population in New York City. Also, NYU's name recognition as well, for the care that they give as well. So it attracts patients to come here because they understand and recognize the quality of care that we do provide to our patient population. And also, I think a factor as well that's most recent is the closure of a recent hospital, I think that as well. So this is all contributed to the continued growth in our department. But one thing we're proud of and proud to say is even with the growth and continued growth, we've continued to maintain, high standard in the quality of care that we deliver to our patients. Next slide. And this is just a quick snapshot of who we see. Given this location, majority of our patients that we do see, within our ED walk-ins and also via ambulance and taxis as well, do come from the neighborhoods around the area, and it actually comes from the zip codes that this community board 6 actually represents. I think zip code 106, 10016 is probably a higher zip code that we see patients from as well. Next slide. Well, I just want to highlight that, we really, our mission of our department is to actually serve our community through exceptional patient care, also to foster innovation in healthcare delivery, research and education, and to develop healthcare leaders. So, there's 4 buckets of things we increasingly and we daily work on as well. So acute care. So, the acute care for patients coming in for critical care and stroke care and cardiac care. We also have specialized program with the ED in our emergency department for pediatric and psychiatric care as well. We are really, place an emphasis on, having the latest technology and innovation and continue doing research with our emergency department, and which I'll highlight later, and also telemedicine and telehealth integration as well, and what that looks like. Next slide. So I just want to just briefly talk about some of the specialized units in our emergency department. We have our core emergency department, which we see all patients of all ages, adult patients. And then we also have 4 specialized units as well. Within our ER, we have an observation unit where patients who have a prolonged ED length of stay or needs a longer period of observation are actually kept in so they can be more comfortable within the ED setting. We also have a fast track unit, which is for patients who are coming in with what we deem as minor complaints, so they can be seen in a timely manner and discharged from the ER as soon as possible. We have a specialized pediatric unit as well for our patients less than 21 years of age. This unit is staffed by a pediatric attendant. And we have other PAs and NPs that also assist in staffing that unit as well. And we also recently, about 3 years ago, opened up a special area in our ER for our patients coming in with primary behavioral health complaints, because we understand that the ERs could be sometimes to some people a stressful environment, and particularly to this patient population as well. So we want to create a setting for this patient population where they can be further cared for by our ED team, including our ED psychiatrists as well. Next slide. When I speak about innovation and innovation and integration of technology within our emergency department, one thing we're very proud of, we want to highlight is our virtual urgent care option that we have within our department. And this is a convenient option for everyday health concerns, fever, cough, cold. It provides our patient population the opportunity for patients to set up an appointment with our ED physician or provider where they could get their needs met and they can be seen for those visits. It's a great opportunity for patients to actually avoid in this community to avoid any ED visits because they can be seen in a timely manner, and it can be accessed easily through the NYU Langone app or the website as well. And also, one thing that's really we've been working on in our department as well is actually integrating a virtual medicine in the ED. So we actually have projects and pilots in place where a remote doctor can actually see and start seeing a patient prior to the in-person doctor to see the patient as well, so we can expedite care for our patients so to avoid any potential delays. Next slide. So now I'm going to go over some list of resources that we do have. We love the care that we give to our patients, and we're very proud of the care that we give to our patients. But we understand that some patients need beyond the acute medical care as well. So this is a list of resources that we have for our patients. We have a 24-hour ED social worker for our patient population. We also have resources for financial counseling referral. One thing I'm going to highlight in a subsequent slide is we just recently onboarded what we call a community health worker in the ED. We also provide flu shots, free diabetes screening, hepatitis B and C screening. And another thing I want to highlight as well in a subsequent slide is, we've really been focusing on opioid intervention. So we partner with New York City Relay Program. I mean, we also provide free Narcan kits as well for our patients. Next slide. So this figure is it's called the 4 factors of health and well-being. As a healthcare institution and as a department as well, we understand that healthcare is more than just treating the person and treating the physical symptom. It's about also identifying social economic factors that can actually impact somebody's well-being as well. There's been multiple publications over the past decade that show that these factors, so the socioeconomic factors, or what we call in healthcare the social determinants of health, which includes factors like housing and security, education, income, access to healthy food, community safety, as well as physical environment, can all have a greater impact on the health outcomes than actually the medical care can. So one thing we're proud of is actually in September, we actually recently, through a grant, hired a healthcare worker in the ED. And the role of this individual is to actually screen our patients to see if they have any, what we call social determinants of health, if they flag high for this social determinants of health, and to assist our patients with the resources. So linking the patients with community-based organizations, food pantries, shelter referrals as well. So we really want to be boots on the ground and first in line. So we really want to continue to, the role of this person is to assist our physicians and nurses and social workers to making sure we are in one accord in treating the person as a whole. Next slide. And just to briefly just talk about our diabetes screening program. It's the objective of this program is actually to screen patients in the ED who are high risk for prediabetes and diabetes. Just a quick background: diabetes it's a chronic illness that actually affects how the body manages sugar. And if it's not detected, it can actually lead, or appropriately cared for, it can actually lead to organ damage, heart attacks, and strokes as well. So we understand how the importance of identifying and diagnosing diabetes at an early stage. So we decided to start screening patients in the ED. And since the program actually started in 2019, and in the table here, I share some data from August of 2022 for the Manhattan campus. Since this time period, we've actually screened over 11,000 patients. And as you can see in the graph, 50% of those patients were actually diagnosed with prediabetes, and about 3% of those patients were diagnosed with diabetes as well. And what we do when we identify these patients is we ensure that they follow up their primary care doctor. And if they don't have any, we set them up with one of our primary care doctors in the NYU system. And if they we identify patients have what we call high-risk diabetes, we actually set them up with our specialists as well, so our endocrinologists. Next slide. And, opioid intervention is, over the past 5, 10 years, it's something, it's a public health crisis. It continues to be a public health emergency. Just recent data has shown that, approximately every 3 hours or so, somebody dies in New York City from a type of overdose, and opioid, one of the most common cause of overdose in New York City. The graph on the left actually highlights that, from New York City DOH data that 777 patients, New York has died of drug overdose during the third quarter of 2023. So what do we do as a department? We screen. We screen first. We are in our triage process. We actually have screening questions to identify patients who are at risk of overdose. And then we provide resources to those patients, including social work resources. We obviously do brief interventions as well. So, managing any acute needs. If a patient come in with a high risk of overdose, or if they come in with complaints of overdose as well. And one thing we're very proud of is that we, in partner with New York City's DOH Relays program, we actually, the Relay team and the Relay program actually provides support for people who are experiencing non-fatal overdose by sending a peer wellness advocate to participate within our emergency department to provide support and education as well. And it's a longitudinal follow. So this peer advocates actually follow the patients for about a year or so. And then it's really great resource for this patient population that's very, very vulnerable. And I have 2 more slides left. Next slide. So this is some of the things that's the things we have within our department in the ED for the acute ED patients. Some of the things we are, we're attaining to do, and we've done some work on, and we want to do more of, is our community outreach and engagement. In the past, we've participated in citywide health fairs and events, including health walks, CPR training. The picture on the slide is a picture of one of our PAs doing CPR training for our patients during a health fair at downtown Brooklyn. This was 2 weeks ago. We also done some collaboration with schools as well, with our goal of promoting health literacy, which I'll talk on briefly. And also we've done in the past, and we plan on doing that as well, partnering, doing some clothing and toy drive. We have a lot of motivated providers in the ED who want to really give back. So we collect, new toys, new clothes in boxes and bins, and we, find local organizations to donate them to as well. And next slide. And it's just briefly overview, looking at the health literacy program. Just want to highlight this program within our department. It's called PEP, or the Prevention and Education Partnership. This program was started in 2015, and its mission was to keep our youth safe and healthy and out the ED. So what the program does is it trains doctors, nurses, PAs, medical students in effective communication and harm reduction strategy. And then after the training, it actually deploys them into classrooms, into local schools to have an open conversation as well. So as you can see here, we've had 500 instructors trained. We've delivered 600 talks, and we've reached, impacted more than 17,000 learners. And in 2022, our program has, just to highlight, our program has become a New York State sponsored opioid overdose prevention program. And this is to address the lack of district-wide overdose prevention for New York City schools. And the last slide. Next slide. And this is, looking ahead, and this is one of the reasons I wanted to, talk to this group as well. We are very proud of the acute care that we give to our patients, in the ED. But we really do want to work as a department to expand and establish new partnership with the community to assist with community-centric programs and preventive initiatives. So if that's, more health education literacy program or community health events, particularly with, Community Health Board 6, working, continuing our work in reaching our vulnerable population outreach as well. That's something we look forward to, and I definitely would, look forward to partner with this committee to talk more and discuss how we can do that as well. Thank you.
Thank you. That was fantastic. Just want to open it up to the committee members for any comments or questions.
Question, what percentage of patients go from the observation to admitting?
That's actually a great question. So there's various observation status. So we have observation under admitted status and observation under the ED. I want to say it's I don't want to misquote the data, so I apologize. I haven't seen that recently. I'm not in charge of the observation unit, but we really try our best to identify the appropriate patients for ED observation because we think those patients will be in the ER for will be in the hospital system for like 12 to 24 hours. So I don't have a exact number for you, so I apologize about that, but I can get back to you about that.
I imagine, or what are you thinking about in working in collaboration with a community? What is your image of that? Since you mentioned that as a priority.
Yeah, it could be as, if there's a local shelter that we could have a partnership with, where we could have our providers come and, speak to, or if there's a, community-based event, like, a health event as well, we would love to support, and participate in that as well. So it's a robust field, but we have a lot of doctors that want to really engage in, want to do a lot of civic engagement and community outreach. So I do want to, work on focusing on, this community, right? The community that we serve, and we serve all of New York City, obviously, but the community that we are located in as well. So if there's any opportunity for us to have, like, rather than ad hoc events or ad hoc partnership, but a sustained partnership with with a school, shelter, with a, community hall, whatever it looks like, that's something we've been trying to explore as well, because we do really want to get back to the community that we serve and also educate people in our community. And if it's just like, if it's our team coming to teach various classes to community board members, right? That would be also something we could do, or give lectures as well. We're definitely willing and open to that as well.
I have a few questions, Doctor. Thank you, first of all, for this fantastic presentation. I've been a patient of NYU for over 20 years, and it's wonderful to see the tremendous improvements that you brought to the emergency services. One of my questions is, today is Mental Health Day, World Day, and we've been seeing an escalation in mental health crisis in New York City, especially as it seems to be, moving down to a younger and younger age group, and we see a lot of issues in schools. You talked a little bit about your collaboration with New York City schools. Can you elaborate a little bit on the type of programming you provide and what kind of interface you have? And can we perhaps encourage schools to engage more with you? Because it's clearly a crisis on so many fronts.
Absolutely. So right now, our active collaboration with New York City schools is the PEP program. So we do a lot of education in terms of like hot topics. So we had education regarding opioid use, vaping as well, and drug use. So those were those were the topic at hand that was provided to us and that we trained them for. But I do think there's opportunity for us to expand those subject topics, right? And talk a little bit about mental health. The great thing about the PEP program is it's within our department, so we can definitely create and curate the topics that we need to address as well. So there's definitely opportunity for us to include, mental health, as you mentioned before, within our broad range of topics that we currently do have as well.
Thank you. The other question I had was, what is the average time from the time somebody enters the ER and is actually attended to?
Oh, that's a great question. You guys are putting me on the spot without my metrics. So right now, and I just want to highlight, with increasing volume, it varies, and also it's based on the chief complaint, the acuity level, and then the overall environment. Our goal is to get a patient to be seen within 15 minutes. That's our goal. So when I say to be seen by a nurse or a clinician within 15 minutes. If a patient's coming in with, unfortunately, things will take us out the way sometimes with if someone's coming in acutely ill, attention kind of focuses on that patient as well. But our daughter provider metrics has been really, even without increasing volume, it's been really sustained. We've been seeing patients within 20, 15 minutes, and that's really bodes well. When we look at our patient comments and feedback, they've been really appreciative of that. And I think we all know, and first of all, I'm sorry that you've been a patient in our ER. I don't want that at all, but I hope the experience that you did have was fine as well, as much as it could be. The ER, I call it, I've been doing this for few years now, the ER is it's an organized chaos, right? You know, nobody wants to go to the ER for fun, and I think patient understands that as well. So they're very mindful of that as well. So we understand that, and our goal, because nobody wants to be in the ED, nobody plans to be in the ED. So our goal is to try to get to the patient as soon as we physically can. You know, we do a lot of staffing, a lot of projects to get patients in the back as soon as possible. But please, if you have any feedback, I would love it. As well about our ER.
Well, thank you very much. I mean, I didn't have that experience because it was years ago, so it's wonderful to know that the attendance time is shortened so dramatically, and it's pretty impressive. So thank you so much.
Yeah, thank you. That was an amazing talk. Just had a quick question. I've seen some emergency rooms, urgent care centers. They have online the wait times. And, it's like, oh, if I go to NYU, am I going to be seen in 10 minutes, or are they really, really busy and it's going to be a couple hours, for something non-emergent? Do you have something like that, or you ever thought about something like that?
So we do have that. I think in our website, we do have the NYU Langone website. We do have the wait times for all our EDs within the NYU system. My advice, it's an average wait time. So it's an average. It depends on the chief complaint, like I was mentioning before as well. As I mentioned during my presentation, one of the luxury and one of the great things we do have is our telemedicine or virtual urgent care unit as well, which can be found within the NYU website and the MyChart app. And it's really a great opportunity. I've used this myself as well to avoid coming to the ER. Great opportunity to have interface with a physician. You can schedule the visit actually. And obviously, if the physician is concerned or the provider is concerned, they will recommend that you go to the ER, and there'll be a communication with our team that you'll come into the ED as well. But yes, to answer your question, it is on the NYU Langone website, and it's an estimated time for all our sites as well.
That's fantastic. Just wanted to see if there's any members of the public who have any questions. Don't think so. So if nobody else has any questions, I just really want to thank you. That was fantastic presentation, and look forward to collaborating with you.
Absolutely. Thank you guys. Great day.
Thank you.
Okay.
We'll send you a copy.
So we are on to our second agenda, which is presentation from NYC Smoke Free on their reality check program.
Hi, everyone. Good evening. My name is Stephanie Mercado Altman. I'm joined here by my colleague, Jasleen Cower. I'm the Manhattan Community Engagement Manager here at New York City Smoke Free. Jasleen, I think we can't see you.
Oh, no. Give me 1 second.
Also, let us know if you'd like us to share the slides or if you will.
All right, yeah, that would be helpful. There you go. Yeah. I think Jasleen has it queued up. Yeah.
Okay.
Yep. Thank you.
Yep, I can pull it up right now.
Perfect. Okay. All right. Well, I just want to start off by first saying thank you so much for having her, Jasleen and I speak with you this evening. I'm no stranger to CB6. I've actually spoken with Brendan offline but last year about our activities here at New York City Smoke Free. But Jasleen is our new youth engagement manager in place of Ayo Ali, who is here. But she'll discuss a little bit about the youth engagement portion of our work. So we'll start off with who we are as the bigger organization at Public Health Solutions. Jasleen, you can go ahead and yeah, thank you. Appreciate it. We're coordinating. Thank you so much. So about Public Health Solutions, so we are the largest public health not-for-profit here in the city, supporting thousands of families in achieving their optimal health and building pathways to reach their potential. We do this through various different programs, whether that be primary care services, WIC services, and along with our program, which is New York City Smoke Free. Next slide. Thanks. So just let you all know, we are a state-funded program funded by the Bureau of Tobacco Control. And our mission as it's a Bureau of Tobacco grantee is really to end the devastating tobacco epidemic that we see here in the city. We do believe and have the vision that every New York City resident has the right to breathe clean, smoke-free air where they live, work, and play. And we help people support, and people who smoke serve the support and resources to quit as well. Next slide. Perfect. So a little bit about our program objectives. So we have a two-pillar program. One is our youth engagement, and the other is our community engagement portion. So Jasleen will be going into more of the day-to-day operations of how the youth engagement program works. But the bottom line really through that through this program initiative is to limit youth exposure and access to tobacco marketing and advertising of flavored tobacco products. And additionally reducing tobacco imagery in youth-related movies and youth-friendly internet sites as well. And this is really through engaging youth and our community partners will support for Smoke-Free City and the health, the tobacco health disparities as well. On the community engagement side, which is more the side that I charge up, is the main objective is to increase the number of apartment buildings, whether these be co-op, condos, or market rate buildings, to go 100% smoke-free. In addition to working with businesses or any sort of local community enterprise and helping them pass a tobacco-free outdoors policy. So yeah, next slide. That's all you. Take it away.
Hi, thank you so much, Stephanie, for such a wonderful introduction. It's very nice to meet everyone. Thank you for having us. I am the new reality check coordinator for Manhattan. So yeah, kind of cover the borough. And yeah, I'll be walking over to the reality check portion of the presentation. So reality check is a statewide program. It's all throughout New York State. So that includes like upstate and all the amazing boroughs. And it's designed for youth between the ages of 13 and 18, and it is primarily focused on tobacco control initiatives. It is primarily just student-led, adult-supported, and its aim is to reduce the number of teens that initiate smoking. I really like this code because I think it really hones down to the problem and why really we exist. Like why is reality check so necessary and so important? And it says that today's teenager is tomorrow's potential regular customer, and the overwhelming majority of the smokers first begin to smoke while still in their teens. And I think it really hones down how the tobacco company is really just looking at the youth as like one of their customers and to get them hooked early on so that they have like lifelong customers for their industry. And the more they do, then the more they stay in business. So just building off from the code, it is, this is from the CDC. The earlier the youth start smoking, the more likely they are to become strongly addicted to nicotine. Almost 90% of the smokers started at or before age 18. And then when we're honing it down to New York City public high school students, we are seeing that more than 13,000 of New York City public high school students smoke. And as a result, 1/3 of them will die prematurely. And astonishingly, 45,000 public high school students in New York City reported e-cig vape product usage in 2017, according to the survey that was done by the New York State. In 2022, nearly 1 in 9 middle school and high school students reported current use of some type of tobacco product. And I guess like to engage the community, I'm like, what kind of tobacco product do you think they use the most? I'm going to give away the answer. I think that my last slide did anyways. It's an e-cigarette, and we refer to the system as the ENDS. That's an acronym that's going to come up later in the slides as well. But it's an electronic nicotine delivery system. I'm not going to go over the whole diagram and different components of it. But I think one thing that I want everyone to take away from the slide is that there is no standard regulation by the US FDA, which, regulates all the drugs and everything that we consume. So to know that it's not regulated makes that it's not safe, and, it's not up for regulation, and it's not being regulated to ensure its efficacy and ensure its safety. Health effects of e-cigarettes. It's very interesting because I think when they first came out in the market, they were very advertised as like, not as harmful as cigarettes, but later on with the research that was done, it actually realized that, most e-cigarettes do contain nicotine, and it's an addictive drug that is just as addictive as cocaine and heroin, which really like was surprising to me. I didn't learn about this till I joined my position. A lot of the smoke that it's exhaled from e-cigarettes can contain cancer-causing agents, ultrafine particles that is the sole contributor to, it eventually leading to lung cancer, heavy metals such as nickel, tin, and lead. And I think one thing that we're still learning, because like we really, like even scientists can keep up with this, but e-cigarettes are still new and we're still learning about their like long-term health effects. We only know about the effects for like past 5 to 10 years, but we really don't know what is like the full long-term effect of how it affects us. E-cigarettes usage by the teens, they are the most common tobacco product used among the middle and high school students. And despite a decline in the cigarette use among the youth in New York State, we have seen a steady decrease ENDS use, which is referring to the e-cigarettes nicotine delivery systems. It has increased by 160% between 2014 and 2018, which really is like highlights how big of an epidemic this is. And ENDS use is higher among New York high school students than adults, with 43.8% of students reported having tried e-cigarettes, which is closer to the half of them, and it is pretty alarming. And I think one of the ways it's interesting is that even just the way they're advertised, which is definitely part of like what we see in the advertising when the e-cigarettes companies are advertising, they use like colors that are very similar to the candies that you see at the grocery store or at the corner store, and it's like very bright and very pink, and they come in all different type of flavors that you can think of: green apple, blueberry, lychee, and mint, and menthol being a great menthol being like one of the most used flavors, which makes it that the smoke is inhaled less harshly. And I guess like some of the benefits of going into like what it looks like to establish a RC chapter. We work with CBOs, as Stephanie mentioned, but I'm also working with a lot of schools, particularly in Manhattan. And some of the benefits of joining RC chapter for students is that they get to develop leadership skills, strengthen their public speaking abilities, build confidence and enhance teamwork skills, engage legislators. We actually get to take our youth on the Legislative Education Day in Albany and talk directly with some of the state assemblymen and state senators, find a safe place to explore interests and utilize talents, and discover a world full of new activities, fulfill service requirements. And students are very creative. Like even today, they came up with these like really creative posters and flyers to educate their communities about the dangers of smoking. So they get to really take their creativity on a next level. Yeah, and I'll give the floor to Stephanie now.
Thanks, Jessie. Appreciate it. Yeah, we're really excited for her to start this work, especially in areas that we haven't worked in, for example, CB6. Yeah, and also in the same way, parallel to Jasleen's work, I charge up the Smoke-Free Housing Initiative here at New York City Smoke-Free. And bottom line is really to encourage the development and implementation of smoke-free housing policies to be passed. And this is done through partnering with landlords, elected officials throughout Manhattan, as well as property managers and co-op or condo boards to assist in the passing of these policies and protections. To date, we have assisted about 54,000 families to live safely in smoke-free buildings. So this is all the way from affordable housing buildings to market rate buildings, condominiums and cooperatives as well, from the bottom to the top of the island as well. And the services that are provided through the process, which can range from a couple of months to a year and a half, it really depends on how fast the policy process does take place, we provide technical assistance, policy templates as well if needed, and referrals to any sort of legal or cessation resources that the decision makers within the different buildings may want to be pointed to. So yeah, next slide, please. Thank you. And lastly, the other part of my work, as the community engagement arm of the Manhattan team is really to encourage also the development and implementation of tobacco-free outdoor policies with businesses or any sort of houses of worship, pretty much anywhere of an entity that is community facing, with this be a retail environment or anything else of that sort. And in this similar way, I also partner and work with health advocates at the local level or community level, as well as elected officials, very much of the same partner profile. But the difference is a community entity of sorts that would help, I would help them establish a TFO or a tobacco-free outdoors policy. That essentially just means establishing a certain number of feet outside of the entryway of the said building or establishment to be a smoke-free zone. Usually it's 20 to 25 feet, but discretion can be 50 feet or whatever it is. And the objective is just people should have the right to breathe cleaner, smoke-free air. This just makes for a healthier community as well. Aesthetically, we don't have cigarette butts on the ground, so that's another nice thing to have, is not littered streets. And we can, walk safe through our neighborhoods without breathing in a secondhand smoke. And again, the same services that are provided for smoke-free housing, for this tobacco-free outdoors initiative, the same sort of services are provided as well. So next slide. Great. So Jessie, do you want to go into your reality check?
Yeah, so some of the ways that we can partner together and how we see this connection going forward is being able to connect to guidance counselors or SAPIS counselors, which are the substance abuse prevention and intervention specialist, or school personnel, whether that's like directors of climate or in school culture, in the middle schools and high schools in CB6 area. Connecting to local organizations who are working with youth population. I know that looking at your website, you also have a youth and education committee, particularly that aligns with very similar goal as to ours. And any tabling opportunities during any of the CB6 events where I can come in and even give a presentation to any of the personnel from the school or for youth organization. So yeah, we have an established partner at Stuyvesant High School, but we are branching out and moving into the Harlem area, Inwood area, and many others. So we really want to make our program as big and have students know that they have resources. Stephanie, I think you can take over.
Okay, awesome. Yeah, and lastly, for my community engagement asks, it's any sort of introductions that could be made either to major developers that are building currently in your district, as well as any community members, residents that live in CB6 who are being involuntarily exposed to secondhand smoke, to find a way to help and assist them through a smoke-free housing policy or just further assistance that they may need. We're here also to lend a helping hand to those folks, even if we don't directly work with them. And then finally, any introduction to any small businesses as well that may be interested in this work and are health conscious. So and I think bottom line for the both of us is that we would love to, if a stepping stone, I know Brendan last year we contributed like a small blurb to your newsletter, to CB6's newsletter or e-blast. So we'd love to start there and see where it goes. Yeah, thank you so much for having us.
Yeah,
Yeah.
and we're happy to answer any questions that you may have.
Absolutely.
Yeah, thank you. That was really fantastic, really important work, and just want to open it up to the committee members. Gordon?
Have you done any outreach to influencers who have podcasts that the young people would be watching? Who would give a PSA every so often so that, the people who would be following them would in fact then say, oh, maybe if they say so.
I'm happy to answer that question. We do use actually TikTok as a platform because I know that a lot of youngsters watch that. So we do, as part of the reality check program, we make like little snippets and little stories, but educating them about the dangers in a more like creative and fun way to reach more younger audience. And we also have our social media platforms. We haven't reached out to influencers. I'm not quite sure how that works because I do think there may be a lot more like legal stuff involved in that sort of thing. So we haven't done that route, but that's an interesting, way to approach it as well. Stephanie, if you want to add anything.
No, beautifully answered. I defer to-
Any questions?
Jesslyn, thank you for the wonderful presentation. I have a quick question. As you work on the youth programming, do you engage with vendors of nicotine products across New York City? Because one of the complaints as a mother I've faced, and as parents we discuss at schools, is that even legitimate vendors will often sell these products to children without asking for an ID, looking at age appropriateness or any of that. So what, if any, engagement do you have on that front?
Yeah, so I'm like fairly like new in the role, so I haven't had like direct engagement on that sort of front. But I think one thing that we do with our kids in the actually the reality check program is that we do like this STARS assessment, which is where we go to the near vendors and near, like, as we call them, the bodega stores or the convenience store, and have them talk about, first of all, like the vicinity of that convenience store from the schools, because I think that's something that we're looking at when we collect a lot of data about like how far are these stores from the schools and how accessible does it make them to go after school and have access to these products. But another thing that we talk about is like how much are they on the display, and I think it's very strategically, because like even the vendors use these strategies of like putting them next to candy. And when you have flavors like, blueberry and mint, it kind of just very much sounds like you're getting a pack of gum, right? And contribute to that, the peer pressure and seeing your peers smoke and it being like the first time experience, right? So I think there's a lot of factors that like contribute to that. But yeah, we do try our best to also go talk to vendors and talk a lot about like, some of the strategies of making sure that, they have these the dangerous side effects on the display, so that it's not like, most of the times it's like they're also trying to make business, so it can get very like hidden at a spot they're not able to see. So making sure that they can educate young people, especially who look under 18, and to have access to these products. So there's a lot of like education and engagement on that front. And I think we are working. Obviously, policy change takes a long time, but we are working, especially with like this new Juul settlement that we're hearing about a lot. Yeah.
Yes, Sandy.
Do you have a list of schools that you're working with in CB6? Do you know yet if you have any schools that you're working with in our district?
Not currently. I have reached out, like it's part of like, I guess, like the cold emailing. I have reached out to the guidance counselors, and I was looking at some of the schools. I know the high school for health and sciences is under the CB6, and a couple of other high schools, but yeah, I haven't fully immersed into that. I guess like that's also why we're here, is that we can finally branch in. And yeah, and obviously like also looking at the demographics, schools with the higher economic need index, where we know that there's a target population, and the communities that really could use this help and could use the resources.
Something we could potentially help with.
Brandon?
So, since I deal with constituent service requests, a question related to the sale of some of these like candy marketed e-cigarettes. Are these even legal? If so, like, is there any like legislation out there addressing that, or proposed legislation out there addressing some of this?
Yeah, so just to confirm, so your question is that like them making it look like candies, is that even legal?
Mm-hmm.
Yeah, unfortunately that is, and that I think that's like where kind of a lot of our work comes in, is to like expose them, because they try to do it in a very strategic way that it doesn't come off as like they just touch the regulations, but like they can get over it with like just like a little tweak. And I guess like that's why they're able to really, target the younger audience, because younger audience obviously doesn't have that like same level of understanding as like, adults, I guess, like are aware of like, why are they advertising it this way, right? And I honestly was not aware myself until I came into this role of like how truly bad it was. And yeah, and I think it's also interesting because I was having a discussion with my students today, right before this, and just like even like we were talking about the study that was done and how actually they're starting to target youth through their social media posts, which is actually like outlawed. Like they're not able to do that. And they have to actually follow the FDA regulations with like having the warning signs, but they come up with their own strategic ways of like hiding it or putting it in the second picture, which is like, well, nobody's going to really slide through and look at the second picture of the post. And majority of the study that actually was recently done found that majority of them were not meeting the FDA guidelines that are set for them to be able to advertise on there. So it's a pretty scary time to live in, to be very honest, like for a younger audience to have all that exposure through various means.
What's the legal age at which you can buy cigarettes? Or is there what's the law about it?
I think it's 18, Stephanie, right? Yeah, it's 18.
18. Yeah.
I was like, it hasn't changed, right? No, it's 18. It's very interesting because I've also had like firsthand exposure, because my dad owns a grocery and a deli store, so I used to, be the one pulling in some shifts when the workers didn't come in, and it's very interesting how youth will try to get it, and I'm like, no, you not today, no, it's outlawed. And yeah, and I guess that's also my dad was very passionate about it. So if he was aware that like a neighborhood store was like selling it to kids or doing it in an unregulated manner, then he would be like 611, hello, I have a so I think it's very interesting how they come in, and and I think that really goes on also like to show like the importance of reducing the amount of like licenses that we're giving out. Technically, New York State has a law about like that only certain neighborhoods can get only this much license, but like even just talking about their vicinity to the school, because I don't know, I think that it was like it came up in the legislation, they were talking about like vaping detectors, but we're really not targeting the problem here, because then students are just going to like skip school and go get one if they really need it, and it's as addictive as we talk, as science tells us. So yeah, I think there just needs to be a lot of like education and awareness, because when students do learn about it, they're very shocked about the effects of it.
In trying to get buildings smoke-free, do you try working with NYCHA or the big companies like Related, or the building management companies, Douglas Elliman? Do you get through them, or?
Yeah, no, thank you for your question. So actually, just to let you know, in 2018, there was a mandate to make all NYCHA buildings smoke-free. So that we were integral in that policy change at the city level. When it comes to bigger property management companies, it's been honestly very hard, I think, post-COVID especially. The climate has changed too, where it's been a little hard for us to get through the door and just offer our services and just make people aware of like the importance of smoke-free housing. Obviously the policies that we do help pass are voluntary, so it's really up to whoever is in charge of that building to pass it, right? So it's not like we're coming from the city saying you have to pass it, but yeah, sometimes it's successful that we make an inroad, sometimes it just doesn't make an inroad. So it kind of depends on the situation, but yeah, if you have any connections, please let me know. Be happy to connect.
Is there any members of the public that have any questions?
Nope.
No? Okay.
Well, thank you so
other-
much.
All right. Thank you so much. That was great.
We'll be in touch.
Absolutely. We'll follow up
Very
with
good.
email. Thank you, everyone.
Very important
Thank you
work.
so much.
Okay, we are on agenda item 3, a brief report from CB6 representative to the Bellevue Hospital Community Advisory Board.
Good evening, all. This is Kevin. By the way, Stephanie and Jasleen, if they're still there, great work on the smoke-free initiatives. It's so important. My report. The first Bellevue Community Advisory Board meeting since summer break was September 25th. It was my first as the CB6 delegate. We didn't go deep on community and policy as the Bellevue CEO, Bill Hicks, gave a valuable in-depth presentation on the long history of Bellevue. Coincidentally, it was announced 5 days later that Bill is retiring in January after 30 years with NYC Health and Hospitals. As for community work, on Monday for 5 hours in the Bellevue Atrium lobby, the Community Advisory Board helped host a voter registration drive. CAB will have 4 committees going forward: health, patient, legislative, and recruitment. I should know at the next meeting on what committee I will serve. I do look forward to helping connect Bellevue more with the community, as I've talked about with Sandy. I should actually, I do know the next meeting is October 23rd, and I will have more community and policy updates to share with the committee after that meeting. Thanks.
Okay, thank you.
Kevin, maybe you can get them to give us a larger meeting room for the board meetings to be more central than Waterside.
You know, that's a great idea, actually. They have the old library is where we actually met and where Bill did his presentation. It's pretty spacious. I don't know if it's, I mean, I'd have to do the measurements and see what the measurements are. That's a great idea. And they might have some other places as well. But the old medical library is what I would recommend.
Thank you. Okay, so moving along to agenda item 4, a discussion of health priorities in Manhattan Community District 6. And what I was hoping was not that we would go in depth into each health priority, but we could pick what we want our agenda to be for the next meeting, and where we'll have time to go in depth into these different issues. And one thing that I've been thinking about over the last few days is that the various New York City agencies, usually when they post announcements on social media, they post it to Twitter. But now there's real fragmentation of social media, and people are on TikTok, they're on Instagram, they're on Threads, and it may not be appropriate to favor one private entity or another when these social media platforms are so big. And so I just wanted to get this committee's thought that maybe this could be a resolution for next month to discuss. Just want to open it up to what you thought.
Could you explain what you mean? What would you be involved in? What do you think?
Well, say NYPD has an announcement. Why just announce it on Twitter? Why not announce it on Instagram and Threads and TikTok? Why is it just going to Twitter?
You mean in general, not just specifically for?
I'm talking about all New York City agencies.
About any announcement, not just related to health.
Right?
So currently,
But
so they only
that
do
is
it
part of
X?
wellness,
Yeah,
that
yeah, I
the
was just trying to
city
understand what you
informs
mean.
you
Sure.
of what's going on. And if people are not on Twitter and they're on these other
Yes.
social media sites, it doesn't make sense that a city should favor one social media site over another.
So but we also get a lot of, I mean, as a member of the public, we often get a lot of emails from different city agencies on health issues. So is it only X? Is it X as the official site where they?
Well, I'll just give you the New York City Department of Transportation posts on Twitter, and members of the certain city agencies look to Twitter to see what people are thinking.
I see.
And that may not be
No,
appropriate
because I
because there's a
looked at Twitter.
fragmentation of our social media milieu. So
The city came up with Notify NYC, which, the rollout hasn't been tremendous, I don't think, I know you have a choice of about 20 different kinds of things that you want to be notified by, and you click the boxes, so I have transportation and, traffic or whatever, and health. And whenever there's something, I get a notice, and when it's done, then I get another notice that the thing has been resolved. That would be a great vehicle for all agencies. But, like, I've, I don't know, 15 years ago, I did a Twitter account and I've never used it since. I mean, I'm sure there's a lot of people who don't go on X. I mean,
Oh, it's very fragmented.
Also, I would have imagined that they would be using their own primary website as the site where they educate people about their programs versus various social media sites.
Well, they're definitely using social media sites to notify the public of what's happening in the city. For example, air quality alerts, all kind, the Department of Transportation.
I mean, it's worthy of
About street
discussion because I
improvements.
don't use X, so I use Instagram, and then other people use Facebook, and other people use Threads, so I think it's certainly worthy of
I don't
discussion.
use any, that's why I'm probably dying in 18 different things. And I would assume that NewYorkCity.gov must be,
That's
have
right, yeah.
filtered all of them, right?
Well,
To do that, I don't, I mean, it's sort
I
of an
think
interesting
worth
point of,
exploring.
huh?
Well, so I'm gonna put it on the agenda
Sure.
Yeah.
Sandy, please.
I wonder if it is on the agenda, if we don't need someone, some expertise on it to come and explain how it works, because, otherwise we're kind of discussing.
Well, I think what the discussion would be is if we're gonna post, the city's gonna post something on a social media site, they should post it on multiple social media sites and should not favor one social media site over another.
I mean, I'm sure there's cost associated with that.
They're
maybe
free.
have somebody from Notify
But
NYC.
you're right,
which
there's
is
an
part of
expert in
OEM.
that agency telling
The
us
other
what they really
one,
do.
of course, is, has one of the other community boards already addressed that. I never thought about even checking how I would find out if what's healthy in this, that there should be a filter, period, right? That the city is presenting as opposed to doing it by these social media. That in itself is troubling because lots of people aren't on any social media. So in terms of what you're saying, that's fine, they shouldn't privilege one. But in fact, there should be one central site that that NYC.gov is operating forever, so that we know that, and I can, don't have to just go to my little,
That's what the
Is there an
Notify NYC is out of OEM,
I don't know, what's on
Office of Emergency Management,
them? Okay,
New York City. This is a site that they set up.
It's a website.
and that,
To
and that
no-
was.
to
and that's
notify
what-
you. And they email, depending upon what your interest is, you have this list that you checkbox when you're first signing up.
So, shouldn't that go on a community board website as a starting point, right?
I think that's where I got it from.
You should stop reading these unexpurgated things that you've been reading.
Because the board website's fabulous. I mean, they've
That's
done a
great.
great job.
Yeah, is it? So you actually think our board has it, so that's terrific.
I guess I'm
right?
trying to understand, is there one particular agency that if this is an agenda item for next month, are we looking at starting out with one specific public agency, or are we looking at multiple agencies?
I think the recommendation would be that any city agency that publishes on one social media site, it should publish
Just
on
across the spectrum.
across the spectrum. And, I think it's amazing that you got your information from CV6, but I would bet that that's a very, very, very tiny
Tiny,
fragment
tiny.
of the population. Whereas, Instagram may have like 1 billion
Yes,
people on it.
100%.
Oh,
So is
sure.
there someone in city council that can come and speak to us and tell us what the practice is, as
From
opposed to
Do It
us?
Pro-
Oh,
Probably.
Lordy, I don't want to get involved with city council.
Yeah, no, maybe-
I just,
maybe-
if you want to do
maybe-
that, can't we just do a little thing?
Maybe somebody from Do It,
Yeah.
because that would be under their,
Right.
Yeah,
But it would be
but
worth
this is,
getting a little more information, I think,
Yeah.
about how the process works and what's.
But I think
But-
it's definitely a very good recommendation to make if that in fact the city is doing
but
that.
if the city's doing it, this site, then it would seem to be, wouldn't you start off with them to say, why don't you get that information on all the social media sites? But just as sort of functioning, rather than do this resolution, somebody take it on to contact this,
Notify NYC.
yeah, and say, hey, you know, that needs to be on all the social media, then you skip the resolution and blah, blah. But-
Brendan, do you think that's something
Yeah, that would
you
be
could help
great.
us with, or?
In terms of identifying someone?
Oh, yeah, from Notify NYC.
Or just notify NYC, can one of the staff do it, and then get back to us, and if they're, you know, if they're willing to, you know.
Yeah,
help it without-
we have, like, there's an intergov wing of the city's Office of Emergency Management, who actually tends to be pretty responsive. They might have someone in mind.
That's great. That sounds good. And they always appreciate if you ask questions ahead of time.
Mhm.
If there was some, you know, outline for what you're looking for from them, you know, how do you disseminate information? You can visit once, or, you know, just kind of give them an agenda.
Yeah, and it would be interesting to see how multiple city agencies across New York City are communicating with the public.
But you said it's from, what that is at,
Yeah, it's,
just,
you know, it's
could you say
Office of Emergency Management, New York City Government.
Office of Emergency Management? So if I just, if
And-
I
and-
just
and-
look that up, I would
And
get
the
to,
site, and the site is Notify NYC.
and that's it. If I just Google notify NYC,
Yeah,
all my troubles will be over.
all of them, all of them.
All of them.
Con Ed would stop billing you.
Oh, yeah, well,
You know, the water that comes through the pipes will
All right.
clean.
Let's get back on track here.
okay, I have a.
Okay, yeah,
this
please.
Thing I wanted to raise is an issue. Because one of the things I would like to see us do is work on one issue for the whole year in some systematic way. I know I've raised this before, and for a lot of reasons. We have continuity, we work as a group, we come up with a topic that we really feel committed to. We get to know one another as a working group. Something I found is not happening in the groups in general. So, and it gives us a tie, but we also can build on. I would like to see us building on a topic over the year. Being able to come up with, lots of things come up in this things today, where will it go, who knows, right? So, and so I went to the public health, well, CUNY has a public health program. And it's both a PhD and a master's level. It does both research in public health. It is also administrative. It's a program I knew about. I still am on the faculty at CUNY, but I've been there for a long time. And it started at some point. It's really grown, I think, very impressively. And it would be an interesting alliance for us, work with them, hear what they have to say, what they would like to see on the community board level. I find it actually a very exciting sort of notion of, they want to work with community. We're a community board who wants to do work on health. They come in with their expertise. They got the graduate students who want the experience of being able to use their expertise in a real situation. And we are a community that has its own issues. And so we bring them in to our meeting, first get in touch with them, see what they'd be interested in and see how we might work collaboratively with them on a topic for the year. And I don't know what that topic, I can't say off, what I think, but I would certainly like to hear what they think. So I'm wondering if that would be what you folks would think about that. A topic we're working on for the year, because I do find it's too fragmented. And I'm very frustrated with the sense I need to have a project that has a start, a middle, and a finish. I'll feel real good about that. And that we're working with people who have particular expertise. obviously I've been in CUNY a long time. Providing opportunities for the students to work in a community, that's how they get their start, right? So it benefits everybody, and we can go from there, but what else is going on? But so that's my.
Well, considering a couple of years ago, you came up with the idea of trying to fight the city to selling the health plan to a private organization, and you won.
I did not win. I was so angry with this group. I have to, you, just let me tell you how angry I was.
You won,
Yeah, you won, but you all defeated me. That was so awful.
but you won nonetheless.
Well, we fought them like hell. We did. And with luck, our mayor will be gone and he will stop doing what he's doing. So disgraceful.
Yeah,
Okay,
yeah, it's-
I know it couldn't, but that was the most disgraceful. Oh, my God. Okay, I tell you can delete that. But anyhow, I'm
Yeah,
very
that's a good
curious.
idea.
I mean, I would love it, and I would love it from the point of view of the CUNY students. I feel very strongly about it. And I'll just briefly tell you, I do run a housing program still. It's an internship, and my students are in various agencies, not-for-profits all over the city. They get jobs in it. They grow as professionals. They recognize it is such a great experience, and for us to provide those kinds of experience as a community board, I think would be incredible. And that's just on our committee, but of course, we should be doing that.
can
And we should be
you,
working on a year-long project. Yes,
Can you speak to the people at CUNY
I can
and get,
talk to.
narrow it down a little bit from, it could be anything to maybe like two or three things.
No, I will get in touch. If this is an interest of this committee, I will get in touch with public health. And, go back to my status as a CUNY member, see what's going on there, and who I can reach out to and go from there. And if somebody wants working along with me, that's, again, the collaboration within committee members, I think, is so important for how committees grow and function. So that's it.
And I did want to add, I mentioned it briefly at full board, but this Tuesday morning, it was a task force for Spark. And that's, CUNY is, going to be part of the campus there. And they specifically want to talk to the community and get feedback and become more engaged. So I think it would be perfect. They definitely, it's already kind of in their mindset of learning more about this community. And they talked about the ecosystem of how people get into the program and what the program can develop. So I do think they'd be very interested.
So that would be also, I don't know who's working with, what part of CUNY is on that.
And
I
it
think
was the
public
head
health.
of the public health
Oh, what's
section.
head of public health?
He gave a presentation. He wasn't at my table, but he did give a presentation.
So that's a starting contact,
Right.
so
I-
we can
I-
start with that.
Yeah. I could ask the EDC to.
What's?
They're in charge of Spark. They're the ones who organize the task force.
Okay.
So we have two items we could discuss next week in further detail.
Please tell me some months, not even.
Oh, in a month, sorry,
Yes,
a
thank
month,
you.
next month. Any other issues that I think are health priorities that we could?
Well, the starting and the ending, maternal care. And senior health care.
So what are you envisioning?
Well, we have.
We had a woman who had a baby, is that
Yeah,
what?
remember we just had a baby.
And now we have an old person.
And I'm over the hill. I went to my radiology test today. I can still hear, there's the need for maternal care, since the United States is particularly poor in that. It's number 32 of the 35 industrial countries. Granted, New York City has more doctors than any place else in the country, but I don't know if we necessarily have the maternal care that should. And there's certainly a lot of young kids and hence young families in CB6.
I guess there's two parts to it. There's one, we can identify problems, if you did, and then the other part that has to come in is how can the community board fit in
Yeah, of course.
to that problem?
That's
So I
right.
think we can identify many different problems, and that certainly is one.
So I would go back to, I'm sorry.
I'm sorry, can I just make a recommendation? That
Please.
We've had two presentations. And rather than just say they were nice and let them die, why don't you make those part of what the committee's looking at? I mean, I think
I'm gonna disagree with you because I wanna go through public health. I wanna go through the public health program at CUNY and find out what they wanna work on. If we go in with this, I don't know what that's fine, but I would really prefer starting with them rather than bringing in issues. I just think it's the wrong
So
So you
direction.
want to have, just so I'm clear, and I'm new here,
What?
you want to have CUNY Department of Public Health identify for public health priorities for New York City,
That's right.
and then recommend to the community board what they think we should
No, I want to
prioritize?
work with them. I want a collaboration with CUNY. I want the community board. I'd love to see the community board collaborate with CUNY as a model. I think it's a really important model from the point of view of developing professionalism in the students who are, the heart of the city. And to collaborate in terms of where the research is going, how they have done analysis in wherever, in our community, that's great. And so you've got the faculty who have a stake in it. You've got their students who can then be the liaison between the expertise of the faculty and the needs of the community board. And then we become the beneficiaries in a sense, because we can then figure out how do we do any kind of outreach in our community, which I find is a bit of a stumbling block in many ways. And we are part of the evolution of the students and the young people in the city. That's how I see it. So to answer your question, I think of starting with with going to the public, in this case, public health, having them come and talk to us, figuring out how we start a collaboration with them, use their students for the project and go from there. I'm going to give you a little example. It's sort of off, but I think it was a great one. Right after Sandy, Hurricane Sandy, CUNY came up with a bunch of money for their internships. There was no money. We were all doing this thing it was terrible, unpaid labor, free labor. So they came up with a whole bunch of money, and they were working with lots of non-for-profits and government agencies. So the kids could be paid. They could then develop the expertise and then use it in different ways. So one of the things they did was the Manhattan Borough President's Office took a bunch of the CUNY students, paid interns. They learned the open data system, which that's quite a challenge. And their goal was to go back to each community board, teach the community board members how to use the open data system. It was a great model, right? So there was the interface between the organizations of the city, the students, and the local community boards, and how we could best use it. So
I think as a model, I just find it fantastic what
It's
you're
a
proposing,
fantastic-
because it's like a student ambassadorship program.
Yeah.
That I get that, I was just trying to understand, are they then going to present to us? It almost sounds like you want them to come up with what is topical right now,
that's right.
and then just train us about it, as opposed to,
Well, it's topical, but it's got to come back to our community in the same way as these kids were trained how to do open data. They come back to our community for us to be able to use it. They're doing whatever research they're doing. I don't know what they're doing in there, in that. But then what can they tell us about the research they're doing that's relevant to our community, that we can then begin to use their students to gather data, reach out. It depends on what they can, where they're at. That would be how I'd say it. Rather than we start with, we're sort of interested in whatever it is, but we don't know what they got to offer us.
Yeah, if I could say those things that what you're suggesting and what Sandy is suggesting is not mutually exclusive, we can certainly look to CUNY. And Sandy's mentioned about the smoking cessation. That is a problem that the community board can,
as a parent, that's a very.
it's very important, and it's something that we do have something to offer there, right? We're not going to deliver babies, right? But
I mean, if we go to, that's a public health issue, so it may be something that they're actually interested in, but it could be very, we could work together in a very productive way.
yeah,
Right, and I think it's a real model that I would love to see then CUNY pick up. CUNY Central pick it up, particularly if they can figure out how to get a grant money out of it.
Yeah.
Right, and they certainly have that, that in place, and then.
In
that could go.
2030, we're going to be sharing space with them. So, because we'll be in the same building.
Of CUNY Central?
No, CUNY at Spark, not CUNY Central.
Oh,
But
okay.
but this particular the public health, faculty will be in that building. So.
Oh, really?
Yeah.
Oh, really? Did they remove the public health division?
Portions of it. Okay,
Okay.
don't.
No,
quote
that's
me.
right, but that's a great, you know,
There will
meeting
be
point.
aspects of CUNY in that building that will then,
Okay.
they want to know.
So are
6
we
years from
proposing
now.
that we'll exclusively just work on this model, or are we also gonna take other issues that are current prevalent issues in the community? And like, for instance, they were just offering free services, right?
Yeah.
That here, if you need us, we'll come and do all the work. Can we have both these initiatives that we pursue? Because I love what you're saying. I do something similar in my nonprofit, where we have student ambassadors, they come up with, we groom them, and then they work with us. But I'm just wondering, like, all I see around me in my neighborhood, in our neighborhoods, is this chronic epidemic of vaping, right? And it's been a chronic epidemic now for 10 years plus. And we used to hear high schools, then we heard middle schools, now we hear even elementary schools are suffering that. I feel it's something that our community would really want. I know other committees are working on, illegal smoke shops, et cetera, to curtail some of those. But I feel like these people are saying, like your CUNY department, saying we have this intelligence we will offer to you. So maybe we can combine those two. I like your idea, but I think for me, that's like a really big problem in New York.
Okay, I'm
Just the
I'm
thought.
sorry, I'm the pragmatist, having been at CUNY for too long. So, you know, I come from that perspective of it, and that might work fine, I don't know, but,
Well, you don't think they will work with another agency? like
well,
that?
no, what I'm saying is that I don't know whether they would or not, but I would tend to want to start with
What
they're at, as opposed to introducing where you're at. Because they're coming in with their sense of expertise, not to then move to your direction. That's my sort of political position on it. But, you know, people may not agree. And obviously it's something to think about. I'm raising it, but I obviously have strong feelings about it.
So just to circle back, the idea is not to solve these issues right now. I just want to
Yeah.
create an agenda for next month.
Yes, so what?
And so I have 3 nice things for the agenda for us to discuss next month. And we can research those 3 things, the social media, the CUNY, and you could reach out to CUNY.
I will do that.
I'll look into the social media thing, gonna look into Notify, NYC, and we're going to discuss smoking cessation more next month. Sound like a plan?
And, one agenda item may be enough.
No, you're right.
I think tonight was a bit overwhelming. Too many. So don't worry about, creating too many agenda items, I guess is
So
best.
maybe we can just keep it for the next 3 meetings as Sandy is recommending. So would you like to choose one as the priority for next meeting?
Well, why don't we all decide what we want to do?
I think we could do 2. I think the CUNY one is going to be dependent on you reaching out.
Mhm.
So that might be the one to wait till December to give
Well,
you
why don't we see
time
what happens?
to make sure, yeah. So before we add it onto the agenda, reach out and see if that's,
Okay, let me try and reach out and I'll get back to you. And if we can get something set up for November, of course, I would say go with it because, it's best to get started. I
So-
think too many things not happen.
so
but I'm not-
that's a maybe for the CUNY if they're willing, and the other 2 are options too. So, okay, with that, I'm going to end the conversation unless anybody has any objections. Okay, so where are we? Old new business, which we basically just did. So if any member of the committee has any old or new business, please raise your hand.
I thought we were supposed to have we were canceling next month, because of some kind of a thing, I forgot, about different kinds of illnesses. So is that canceled?
I'm not
Remember the
aware.
thing that Elvie said, or about
Yeah, one, she did mention that we would
that
be
we're
skipping
not
a month.
gonna meet in November because of this, thing that, well, I can remember West Nile.
What's in the
virus, I'm
minutes?
sorry.
Well,
I
I can't
believe there
remember.
was some difficulty finding speakers for the items that she wanted to talk about.
So we can just do this instead, that'll be great. Okay, perfect.
okay, so if there are no objections, we will adjourn the meeting at 8:04 p.m. Oh, I'm supposed to wait to see if you have any objections.
Who gave
See.
you that hammer?
I got it from prison.